right, coming up right now, guess what? Cancer patients and their oncologists have new treatment options available to them. The FDA has approved 87 new therapies for various cancers in just the past 5 years. But for most of these new therapies to be effective, a comprehensive genomic test is first required. Today we're joined by Dr. Neil Iger, and research oncologist with the Breast Cancer Research Foundation, along with cancer patient and advocate Karen Peterson, to discuss this further. Dr. Karen, it's so great to see you both. Thank you for your time, and we're excited about this this new therapy, comprehensive genomic testing. Can you give us a little bit more information on this?
Yes, so thank you for having us. It's a pleasure to be here. Genomic testing is a very important tool that is available to patients and their physicians for better understanding an individual's cancer. It's a tool that tests the DNA or genes in the cancer cells, and it gives us an idea of how that specific individual's cancer might behave so that we can match the treatment that's right for that person.
That is great that you can make it more specific like that. And we've got 87 new ideas for ways to help people. I want to talk to Karen real quick. You were diagnosed with stage 4 metastatic breast cancer 2 years ago, and it was in other parts of your body. How are you doing now?
I'm doing so much better. Thank you for asking. As of my last scan in September, I am considered what is known as NED, no evidence of disease. So I'm very humbled and very thankful that I was able to use genomic testing to help me narrow down my choices and focus on getting to a clinical trial that was targeting the particular mutation that I had. So it was really important. And I think it's also important to let people know that if you're really thinking about it and you want to discuss it with your healthcare provider, there's a site called testingmycancer.com. And you can go on that site and you can take a look around and then have a discussion with your healthcare provider in regards to, thinking about whether genomic testing would be good for your individual case.
I highly recommend that as well. Now Dr. Iger, let's say you're diagnosed with cancer.
So,
how far
ahead? I was
ahead?
able to use genomic testing to narrow down my choices and get into a clinical trial is the importance of my story. I think self-advocacy is really important. I think the importance of valuing your voice as a patient. And if you feel like you're not getting you're not being heard, or you're not, all your options are not being explored, you should definitely go and get a second opinion. You should definitely reach out to another healthcare professional who can help you and will collaborate with you in order to get the treatment plan that you want.
And it's great, Karen, that you're the voice of this for other women. I know that they look up to you for the things that you've been through, and you can help them through. That's really great that you're doing that.
Yes, doctor, how soon after you're diagnosed
really
do you need to have this testing done?
That's a great question. So genomic testing can really be done at any time point after a diagnosis. It really depends on the type of cancer and the stage of cancer, but I think that it's a very important discussion, as Karen has mentioned, to have with your doctor right at the time you're diagnosed with cancer, whether or not genomic testing is the right test for you.
I'm really curious about the differences in the different kinds of treatments. I know we can't get into all that today, but I'm so thankful that there are new treatments and you're seeing them all the time. And you are the forefront of that. You get to work on those cases, doctor.
Yes, thank you. I'm very privileged and fortunate to be able to really try to help push the science forward. And as Karen mentioned, that comes as a partnership with patient advocates who identify the important research questions that we can take back to the laboratory and into the clinics to develop new drugs for individuals. As you've mentioned, we've seen an incredible pace in the approval rate of new drugs. So the science is really moving forward, and the field is looking up for cancer treatment.
Doctor, one more quick question. It is Breast Cancer Awareness Month. It's on the forefront of everyone's mind. We're praying for a cure. You're in it every single day with research. Is there something to look forward to? Is there hope still that we will find a cure?
There is always hope, and there is a lot of hope to be had, especially right now. It's a very exciting time in cancer research with new tools like genomic testing, with new ways of getting our new findings out to individuals in an expeditious manner. For example, individuals can look to the Metastatic Breast Cancer Alliance, their app MBC Connect, to discover the new trials of new drugs that are coming down the pipeline.
I love that this is specific to each individual. It's not just one size fits all, and that you can really make this fit each person's need, because I think that's kind of an issue sometimes. We have one thing and it just doesn't work for everybody.
That's a very important point. Cancer treatment needs to be individualized, and so tools like genomic testing are very important, and that conversation with your doctor needs to center around individualized care.
Yes, thank you so much.
You
We
both.
appreciate you being here. Karen, we're blessed that you're here, and
Yes.
we wish you all the best. Thanks so much.
Thank you. I appreciate it.
Thank you.
Thank you both for joining us.
All
Yeah,
right.
isn't that interesting?
Yes, it is. Don't go anywhere. More fun on Ozarks Fox AM right after this. I'm glad that she is
She's so well.
non-detected.
She's doing great. Yeah. Isn't that
Non-detected. That's
wonderful?
amazing.
Yeah. Because
Wow.
that was quite
And
a
it's-